Good day everyone! In this video, we will be discussing about the learners with difficulty hearing. But first, let me discuss the definition of the learners with difficulty hearing. Learners with difficulty hearing refers to students with an issue regarding hearing that interferes with academics. So these are those students with hearing impairments. The IDEA, or Individuals with Disabilities Education Act, defines hearing impairment as an impairment in hearing, whether permanent or fluctuating, that adversely affects a child's educational performance but not included under the definition of deafness. Hearing impairment is a hearing loss below 90 decibels. It may exist in one ear or in both ears. So a person with hearing impairments have this mild to severe hearing loss. Deafness is viewed as a condition that prevents an individual from receiving sound in all or most of its forms. So it is considered when hearing loss is above 90 decibels. A hearing loss above 90 decibels is considered as a profound hearing loss. So a deaf person can hear a little, but more likely, they will not hear at all. Now, let me show you the degree of hearing loss based on a classification system in decibels. So normal have a decibels of -10 to 15, a slight from 16 to 25 decibels, mild from 26 to 40 decibels, and moderate from 41 to 55 decibels, moderate severe from 55 to 70 decibels, severe from 71 to 90 decibels, and profound hearing loss have this 91 plus decibels. So those who have mild to severe hearing loss is classified as with hearing impairments. Those with profound hearing loss is considered with deafness. Here are some of the units used to measure the sounds. So we have the decibels. Decibels is a unit used to measure the loudness and intensity of a sound. So the higher decibel level, the louder the noise. Hertz. Hertz is a unit used to measure the frequency or pitch of the sound. Hearing loss could be acquired or congenital. Acquired if the hearing loss occurred after birth. So the hearing loss happens when as the child ages. So next is congenital. So this is a hearing loss present at birth. There are factors affecting the development of the communication skills to those persons with hearing impairments. So first is we have the intelligence. It is where the cognitive and motor skills development of a person with hearing disability will affect his communication skills, because most likely those persons with a hearing disability or hearing impairment have this slow development in cognitive and motor skills. Second is behavior. So students with hearing impairments are usually introverts, and some of them find it difficult to control on their own behavior and emotions. The third is the degree and nature of deafness and residual hearing. The fourth is the family environment. So a positive and supportive family could help the children with hearing impairment to cope up with his or her difficulties. So the age of onset. The earlier children with hearing loss starts getting services, the more potential likely they will cope up with their difficulties in speech and language skills. There are four types of hearing loss. So first is we have the conjunctive hearing losses. This is caused by the diseases or the distractions in the outer or in the middle ear. Second is we have the sensorineural hearing losses. So this results from the damage to the delicate sensory hair cells of the inner ear. Sometimes, the use of hearing aids is not anymore effective. Third is we have the mixed hearing losses. It is the combination of conductive and sensorineural hearing losses, which means that there is a damage in both the outer and the inner ear. The fourth is we have the central hearing losses. So this results to the nerves of the central nervous system, either in the pathway of the brain or the brain itself. So it is where the brain has these difficulties in interpreting the signals, even though that the transmission of the signals is successful from the ear. Children with hearing impairments will have delay in speech development and language skills. The areas of the brain used for communication may not develop appropriately. Learners with hearing difficulties will have missed out auditory informations such as vocabulary and social language learning. Those who have hearing loss present at birth are more functionally disabled than those who lose their hearing after the language and speech development. So this would be all for the definition, and now let us learn more about learners with difficulties hearing and keep watching. Thank you.
Good day everyone. This is Mary Maxine Magan, and I will discuss to you the causes of hearing impairment or the causes of learners with difficulty hearing. First is aging. So the effects of aging are numerous. Age-related hearing loss is called presbyacosis and affects the majority of those over 60 years of age and certainly those over 70 years. It is the most common cause of hearing loss. So aging. Mostly, we can observe that if magkataas gani ang edad sa isa ka person, parts of the auditory system may be affected. So dili ra na tungod kay sa iyang edad nagkataas, but it is also because of the earlier stages that happen to a person, especially when they are exposed to higher pitch sounds of the environment. Aging can also mean that the auditory nerve and the hearing centers in the brain can lose the ability to process the sound efficiently. That is why it can cause hearing impairment. So, noise exposure. Exposure to excessive noise is generally considered to be the second most common cause of hearing loss. So the higher the noise level or the longer the duration of exposure, the greater is the likelihood of permanent hearing loss, often with tinnitus. So, if magpalabi di ay ka og expose yourself into excessive noise, you may consider to have a hearing loss. So, dapat jud dili ka magpalabi o expose yourself to loud noise, or even ka nang mag-wear bitaw mo og earphones or headphones and you will have the maximum volume level. Dapat dili mo dapat i-expose yourself too much kay it can cause hearing loss. Medications. So, some medications are known to cause sensorineural hearing loss, and these are called ototoxic drugs. So even aspirin can cause hearing loss if taken in regular, larger doses, but usually the hearing loss is reversible once the medication is stopped. So if tagaan galit tag medication, we must take what is prescribed by the doctor. Kaya if too much medications can also cause hearing loss. Infectious diseases. So there are many infectious diseases, bacterial and viral, which can cause sensorineural hearing loss, with some of them typically affecting one ear only. So ang infectious diseases, they can cause hearing loss, but not totally with the two ears typically, but affecting only one ear. So although not a full list, the more common ones are measles, mumps, meningitis, chickenpox, shingles, and influenza. Excessive wax. So excessive wax is one of the most common cause of hearing loss. So any blockage in the ear canal prevents sound transmission. So excessive wax, kabantay mo ka ng manguha bitaw taog wax in our ears, and we will use cotton buds, and daghay mag-prescribe ana nga dili jud dapat cotton buds ikuha kay if maggamit kuno taog cotton buds, we push the wax pasod sa eardrums. Maybe naay tay makuha, but mostly daw masod sa eardrum. Mo na nga magpundo ang atong excessive wax sa atong ears. Mo na nga it can cause hearing loss. Next is barotrauma. So any abnormal pressure in the middle ear cavity due to inadequate ventilation and drainage of the middle ear cavity can put the eardrum under such stress that it perforates. So shown in the picture, the eardrum has been disturbed since napuwa siya sa picture. It is because of the significant changes or significant atmospheric pressure changes, parihaan ng mag-diving or flying, which can cause hearing loss kay nag-change man ang pressure, or it can pain the ears, or some cases it has or it may consider eardrum rupture or barotrauma. Meniere's disorder. So Meniere's disorder syndrome is the most common condition involving both hearing loss and balance problems, often with tinnitus in one or both ears. So sudden attacks of dizziness are a particularly unpleasant aspect of this condition, which are often accompanied by a fluctuating hearing loss and low-pitched tinnitus. Otitis externa, so commonly referred as swimmer's ear infection. It is referred that way because it is most common to swimmers because they are frequent exposed to waters, which does make the canal more vulnerable to infections and inflammations. So otitis externa is any swelling in the ear canal due to allergy, skin infection, or inflammation can affect hearing. Lastly, trauma and inflammation. So the external ear pinna or auricle can be damaged by trauma or inflammation, or there can be a congenital abnormality like present at birth.
Good day, everyone. So here's the continuation of the discussion about the learners with difficulty hearing. So I am Genevieve Amalaran, and on my part, we're going to tackle about hearing loss. So a hearing loss can happen when any part of our ear or our auditory system is not working in the usual way. It means that if there's a defect in your ear, then it also means that you already have a hearing loss. Because it's not necessarily mean that if you lost your sense of hearing completely, like among or dili na siya kakadungog completely, more na hearing loss. No. We have different types of hearing loss and the degree of hearing loss. And we'll tackle about that later on as we continue our discussion. Okay. So here's the part of our ear with its label. We have the outer ear, the middle ear, and the inner ear. We also have the earlobe, our ear canal, and our eardrum. So the outer part of, or the outer ear is made up of the part we see on the sides of our heads, known as perenna. The ear canal, so this is still part of our outer ear. And the eardrum, or sometimes called the tympanic membrane, which separates the outer and middle ear. So kini siya dito doon. So that's why doctors recommend or to not use cotton buds when cleaning our ear, kay kanang it can cause a tearing of our eardrum, maong makakos na siya og kanang hearing loss, so makadamage na siya sa atong dunggan. And the middle ear is made up of the eardrum also. And the three small bones called ossicles that send the movement of the eardrum to the inner ear. And our inner ear is made up of the snail-shaped organ for hearing known as the cochlea. So this is the cochlea. As you can see, it looks like a snail. The semicircular canal that help with balance, and the nerves that go to the brain. So that's what inner ear is made up of. So there's some terms in hearing loss in our ear that we have to remember. So the auditory or the ear nerve, so this nerve sends sound information from the ear to the brain. So mao ni magda sa sound information nga atong nadungog from our ear ngadto sa brain para ma-process, para ma-analyze ug ma-understand nato ang meaning sa sound information nga atong nadungog. So kinsa man sad ang mag-process, since si auditory nerve or si ear nerve ang magdala sa sound information gikan sa atong dunggan ngadto sa ato ang brain, kinsa man sad ang mo-process. So it will be processed by the auditory or the hearing system. The auditory pathway processes sound information as it travels from the ear to the brain so that our brain pathways are part of our hearing. So si auditory or hearing system di ay ang mag-process para so that we can understand the context of the sound information that we heard and was sent by our auditory or ear nerve. So, mao din na siya. So, here's our types of hearing loss that we have to remember. No, kay dili lang kay amang og bungol-bungol atong hibaw-an, no, kay basta na lang siya dili basta kanang maglugos sig dungog atong ngan kay bungol-bungol. Nya kanang dili na siya makadungog atong ingon amang. Pero nada siya types of hearing loss. Alright, so the first one is the conductive hearing loss. So this hearing loss is caused by something that stops sound from getting through the outer or middle ear. This type of hearing loss can often be treated with medicine or surgery. So, adinhi pa lang na siya sa gawas daan kung mo stop na gani ang entrance sa sound, it means that we have a conductive hearing loss. No? Pero this type of hearing loss can be treated, man said. Or it can be treated with medicine or surgery. So it's like not that harmful, but still can be harmful if not treated well. Alright? The next one is the sensorineural hearing loss. So this hearing loss occurs when there is a problem in the way the inner ear or hearing nerve works. So the way that the sound information the way that the ear nerve sends the sound information from the ear to the brain. No, it's the sensorineural. So if there's a defect on kanang how the nerve transfers the sound information, kung ma-stuck na gani siya sa kanang inner ear, so hinumdum mo sa iyahang sa part sa ear, so that's a sensorineural hearing loss. Ana siya ma-stuck sa inner ear. Unlike on the conductive hearing loss nga naa pa gani siya sa gawas, wala na ka-entra ang sound. Yan na. The mixed hearing loss is the combination of both conductive and sensorineural hearing loss. And there's the auditory neuropathy spectrum disorder. So it is a hearing loss that occurs when sound enters the ear normally, but because of damage to the inner ear or the hearing nerve, sound isn't organized in a way that the brain can understand. So kini siya si auditory neuropathy spectrum disorder is somewhat similar to sensorineural hearing loss, but this type of hearing loss, it's that okay siya pag-enter, na problem gihapon or na damage sa imong inner ear or the imong hearing nerve. Maunang ang sound is makasud siya, pero maglugos ug analyze ang brain sa sound information nga gi-transfer gikan sa imong ear ngadto sa imong brain. Unlike sa sensorineural hearing loss nga nay problem sa imong inner ear mo nang dili kasud ang sound. Ang conductive hearing loss is ang problem niya is naapa sa siya gawas sa outer ear o sa middle ear. And this auditory neuropathy spectrum disorder is that makasud man siya pero dili ka-analyze ang brain sa sound information because there's a problem in entering the ear. So, mo na siya. Now, here's the degree of hearing loss, and it can range from mild to profound. Kanang the way unsa ba siya, kanang makadug ba siya gamay nya, or sakto ka makikonverse na sa iya, pero kana kung hung maglugos na siya dungog or need nimo make your voice a little louder para madungog kaniya. So ingana ang degree of hearing loss, and we're going to tackle that now. So here's the mild hearing loss. A person with mild hearing loss may hear some speech sounds, but soft sounds are hard to hear. It's like if you're conversing with a person with a mild hearing loss in a normal level, or like this, so makadungog siya. You can converse well with that person. But if you make your voice a little hinay, a little softer, then maglugos na siya dungog. It's like kadang manglibak ka ng person nga ayaw ba ninyo sanduga, kanang inyong libak ko ng nga person nga na ay mild hearing loss, and then maghunghunghung ramos inyong kauban, dili jud kaniya madunggan. Or like if you call that person, kung layo ra kaniyan imo siyang tawagon, maglugosin na siya dungog. So I know someone nga na ay mild hearing loss nga kung hinayon na ni magtingog imong istorya kanay mo tawagon bitaw nga te nga na bitaw maglugos siya dungog, or kanang nasa sa layo ni imong tawagon bisan og normal pitch nga tingog na imong gigamit kay maglugos siya dungog. So that's the mild hearing loss, no? Normal level okay, but the soft sounds they can hardly hear those. The next one is the moderate hearing loss. A person with a moderate hearing loss may hear almost no speech when another person is talking at a normal level. So maglugo siya dungog kung ang imuhang sound or imuhang tingog is at a normal level ra. Mo na ang moderate hearing loss. So if you're conversing with a moderate with a person with a moderate hearing loss, you need to use you need to make your voice a little louder para makasinabot mo. Kay makadungog man siya in a normal level pero dili kaayo. So maglugos na siya og dungog. So a person with severe hearing loss will hear no speech when a person is talking at a normal level and only some loud sounds. So ani gid ang severe hearing loss is dili na gyud mo magkasinabot kung normal ra nga tingog ang imong gamiton. Kung ang imong tingog is just in a normal level, nga na. So you need to make your voice every time or every second that you're talking. So dapat nimo voice a little louder. Kung mahimo kay dili na gyud mo magkasinabot. And here's the last is a profound hearing loss. So, a person with a profound hearing loss will not hear any speech and only very loud sounds. So dili mo na gyud ni nga need na gyud mo isinggit ang imong istorya. So kay bitong koan, I know someone nga amang siya kanang I have a cousin na kanang amang so dili siya kadungog og kanang bisan pag magsinggit ingana makadungog siya koan mga loud beats sa music kanang naay disco or kanang naay sounds kay he was a dancer man. Oh, how can he dance kanang kung wala siya makadungog sa loud beats sa music? Ana. And here's some hearing loss can also be described as unilateral or bilateral. So hearing loss is if the hearing loss is in one ear, it is called as unilateral. Kung dili ra ka bungol-bungol or maglugos og dungog sa pikas sa right side or sa left side, either one of them, that's called unilateral. Pero kung both ears na nimo ang naay hearing defect, then that's called bilateral. Hearing loss, when the hearing loss happened before a person learned to talk, it's called as prelingual. But if a hearing loss happened after a person learned to talk, it's called as postlingual. So from the word lingual, no, it has something to do with talk or language. So kung nadana niya ang hearing loss, wala pa siya makahibaw og istorya, that's pre, that's before. And after is post. Next is progressive or sudden. When a hearing loss worsens over time, so kung magkatiguang ka, magkaanam o kagrabe ang imong nabatian nga bukabungol, so pag una mild pa to, and then pag 1 nimo ay 5 nimo mild pa to, pag abot nimo 15 nahimo na siyang moderate, pag 25 nahimo na siyang severe, then pag tungtong nimo 40 na profound hearing loss na imong gibati, so that's progressive. Pero kung kalit-kalit ra nga panghita po, that's called sudden, of course. From the word kalit, quickly, so that's sudden. So when the hearing loss is the same in both ears, so kung pareho ang imong nabati, like when you have conductive on both ears, or if you have a sensory neural hearing loss on both ears, or that disorder, katong the fourth type of hearing loss, so that's called symmetrical. Or like if you have mixed on both, that's symmetrical. Pero if you have different hearing loss in each ear, like you have conductive here in your right ear, and you have the sensory neural on your left ear, that's called asymmetrical. So you have congenital or acquired or delayed onset. So, when a hearing loss is present at birth, that's called congenital. Kung inborn na ang imong hearing loss, that's congenital. Or if it appears sometime later in life, it's called acquired or delayed onset. So, kato akong kailangan na ay kanang mild hearing loss. Ako ang kanang asawa to siya sa akong igagaw. Kuan to siya kanang acquired or delayed onset tong iyaha kay dili naman to siya inborn kay ingon to siya nga kanang wala pa man ko to nagdako siya kanang tungod labi taw sa kahago it can affect ang imong lifestyle kay katong hago daw sila niya kanang maglukdok kuno sila mga kahoy, mga kabuog tubig nya bugat nya na. So it affected how her ear dahil kay budget nito siya. It affected her ear. So mao to nga kanang nagka-defect ang iyahang dunggan, mato na-acquire niya ang mild hearing loss. That's why na we need to take care of our ear. So dili ta patakaog ka ng pangoton buds. Yan na. Anya di ta mag-arsa-arsa og mga bugat kayo nga mumurag mo bagting ang imong dunggan tungod sa kabugat, no? Because it can affect their ear and mabasin og maka-acquire tag hearing loss. Okay. So napadaay it fluctuating or stable. So hearing loss gets either better or worse over time. It's called fluctuating. Kung either mo ayo or maka-adjust sa kanang imong mga remedies ang imong hearing loss, or mo samot hinuon og kanang maot or musabot nun ka bungol over time, it's called fluctuating. But if it stays the same over time, it's stable, of course. So here's your reference if you are curious of kung disan ako gikuha ang mga information nga akong gibutang dara sa akong presentation. So you can just search. So that's it about hearing loss, and I hope that you have learned something. And thank you for listening, and there's still next part after me. So that's all, and please take care of your ears.
Good day, I am Kyle Christian Malesa, and now I am going to discuss about the identification of a learner with difficulty hearing. Good day, I am Kyle Christian Malesa, and now I am going to discuss about the identification of a learner with difficulty hearing. Okay, now, so let's proceed to the identification of learners with difficulty hearing. Okay, we have here the first identification of a learner with difficulty hearing. So the first one is speaking loudly. It is very an undesirable characteristic of a learner to speak loudly in front to the person he or she is speaking to. So let's say, for example, student A is speaking loudly in front of student B. So in that particular instances, we can say or we can conclude that a learner has really difficulty in hearing or disability when it comes to hearing, because why not speak in a moderate voice if a learner can? So we can say that a learner has difficulty hearing when he or she is speaking loudly. The second identification is positioning the ear toward the direction of the one speaking. It is unnatural of a learner or a person to do that. A normal person would never position his or her ear in front or toward the direction of the one speaking unless a learner really has a difficulty in hearing, or learners are speaking or communicating in a very loud surrounding. So that's the second identification, positioning the ear toward the direction of the one speaking. The third identification is asking the information to be repeated again and again. If a person or a learner do not really have difficulty hearing, why bother to ask the information to be repeated again and again if he or she can hear the information relate to him or her at once? The next identification of a learner with difficulty hearing is delay of the development speech. The next one is watching the face of the speaker intently. The next, favoring one ear. Another example or another identification of learner with difficulty hearing is not responding with call. So let's say, for example, student A is trying to deliver a message to student B, but student B didn't respond any to the message of student A. In this situation, we can say that student B has really difficulty in hearing or has hearing loss, because if student B do really hear what student A is trying to speak to him, so why not respond to the message of student A? In that example, we can say that not responding when called is an identification or is an implication of a learner with difficulty hearing. Next identification is a learner has difficulty in following directions. Next identification is a learner does not mind loud noises. And lastly, a learner is learning close to the source of sound. Let's say, for example, a student named Mark is studying diligently near in an area where there is disco. As a student, I know or I believe that it is hard for us to study where there is so much loud noises, and I can relate to it. So, and I think it is also an identification that a student or a learner is having a hearing difficulty. Okay, that's it. Those are the identification that a learner has difficulty hearing.
Good day, everyone. I am Marie Kimberly Mancao, and I will be discussing the learning characteristics of learners with difficulty hearing. So, since much of learning is acquired through hearing, students with hearing problems have deficiencies in language and in their experiences. Since they miss out daily conversations, they miss crucial information that non-hearing impaired students learn incidentally. So students may overcome these problems by investing time, energy, and combined effort by both parents and educators. So dako jud ang tabang ang parents ug ang educators para ang mga learners with difficulty hearing is maka-communicate ug makasabot sa ilahang kastorya. So most learners with difficulty hearing use various methods of communication. The most common is the use of hearing aids combined with lip reading. So for example, ang teacher is nag-teach sa learners with difficulty hearing. Ang iyang paagi sa pag-teach is ang pagbasa sa lips niya. So for example, ang word nga libro, tarungon sa teacher og pronounce or istorya ang libro para makasabot ang learners with difficulty hearing nga libro di ay ang pasabot sa gistorya sa teacher. So these students are referred to as oral since they communicate through speech as opposed to sign language. So since naman sila difficulty hearing, ang ilahang paagi sa pag-communicate is through speech or ang pagstorya sa lain nga tao. So they might have delayed communication skills since the development of vocabulary is lower. So if kanang mag-communicate sila or ma-interact sila sa laing mga estudyante or mga normal na mga estudyante, madelay ilang communication skills kay mag-process pa man na sila or ilang mag-lip read pa na sila, ilang sabton pa una o kung say gistorya sa iyang kastorya para napa siya feedback after sa gistorya sa iyang kastorya. That's why madelay ilang communication skills. So they understand concepts when the sentence structure is simpler. Okay, since naman sila difficulty hearing, so
maglisod sila sabot sa mga sentence na complex. For example, ang ilahang kasturya is mga lisod na nga mga words ang communicate nila, and then ang gistoryahan or ang student nga na difficulty hearing, maglisod sila og sabot sa usay gistorya sa iyang kastorya. Maunang mas makasabot pa sila og mga simple nga mga sentence or mga words. So next, interacting with students can be a challenge, so they prefer to work on their own. Kay naman sila difficulty, mas maglisod sila og sabot sa ilang kastorya, mao nang mag-prefer nila nga sila na raman or was ka work or was ka collaborate, was ka communicate, kay maglisod man siya og communicate since naman siya difficulty hearing. So, some hearing impaired students use note takers in class since it is difficult to lip read and take notes simultaneously. So, naay ubang mga learners with difficulty hearing, prefer sila og mag-note taking, kay napayuban nga maglisod sila og mag-lip read, maunang mag-note taking sila. So that's all for my part. Let's proceed to the next reporter. Thank you.
So, good day everyone. My name is Mylene R. Marabulas and I am the last reporter for our topic about learners having difficulty hearing. And today, I will be discussing on the general educational adaptations, to be specific, the ways in helping the hearing impaired students in the class. So there is an assumption that the only adjustment for hearing impaired student is to make all the instructional materials and techniques in written format. And by that, the following ways are discovered to be used to help the hearing impaired students to adapt in the class. First, teachers should help students with difficulty hearing to use the residual hearing they may have. In this way, the teacher will help the student to at least prevent a totally loss of hearing, and by this, the hearing skill of student having difficulty in hearing will be exercised. Second, teachers should help students develop the ability for speech reading or watching other lips, mouth, and expressions. So an example of it is the lip reading. Sometimes it is called the speech reading. So in which it is the ability to understand speech by carefully watching the lip patterns and movement of the tongue and face of the person who is speaking. Third, teachers should be mindful to face the class at all times when presenting information while ensuring that the students with difficulty hearing sit near them. So if the student is sitting in front of the classroom with all the other students behind them, it may be easier to follow the conversation when the teacher is talking. Fourth, exaggerating the pronunciation of words should not be done, for it just makes it difficult for the student with difficulty hearing. So many people try to help by shouting and by exaggerating the pronunciation of words. So this does not help. People who wear hearing aids can experience extreme discomfort if people shout at them. So it is better to speak clearly, a little more loudly than usual, and not that fast. Shouting and over-mounting words will alter the lip pattern, and speaking too slowly will destroy the natural rhythm of the speech. Fifth, directions as well as important parts of the lesson should always be written on the board. So by this one, students will become aware on what will be the lesson that they might be dealing with, and in addition by that, their prior knowledge might become a help for them to really understand that specific topic. Sixth, written or pictorial directions instead of verbal directions may be given. So an example is in math instruction. For students who are hearing impaired or deaf, can be complicated for a number of reasons. However, it is easy to modify and adapt due to the current trend of providing more visual presentations of math in the classroom. Students who have a hearing impairment may need extra support learning about basic in learning the basic math, vocabulary, and concepts to be able to participate fully in the classroom's activities. Seventh, steps to an activity may be physically acted out instead of verbally given. So the teacher might limit the time spent on lectures and focus attention on teaching through hands-on activities. So this allows the students to interact with the lesson in a manner that does not cause fatigue. So it can be exhausting for the student to follow along with the lesson either through the use of an interpreter, speech reading, or his or her own hearing. So 8, a variety of multisensory activities should be given to allow the students to focus on their learning strengths. So a multisensory learning approach, by the way, is a term many schools use to describe teaching methods that involve engaging more than one sense at a time. So it involves the use of visual, auditory, and kinesthetic tactile pathways. So a multisensory approach can enhance memory and ability to learn. So this can also include taste, smell, touch, sight, hearing, and movement. So the students are able to experience a lesson through multiple pathways that can best stimulate their brains and engage them more deeply in the subject matter. So the 9th and the last ways, teachers should be more patient when waiting to hear a response from a hearing impaired student, which may take longer than the usual. So participation and interaction in tutorials may be a limited one to students who cannot hear the flow, and the sense of rapid verbal exchange will be at a disadvantage. So that would be all for my topic. I hope you learned something. Thank you and God bless.